Hi, and today we're going to be talking about another one of the hottest trends in dental health community. Today we're going to be talking about oil pulling, which is so hot these days. That's some of the celebrities are like Gwyneth Paltrow are claiming to be avid oil pullers. And I'll tell you my professional opinion as to whether or not this oil pulling works for my patients or not. So this may be a new trend, but oil pulling has actually been an old traditional folk remedy in India. They've been doing this for over 3,000 years. So the way oil pulling works is you're supposed to put a certain amount of oil in your mouth, and you're supposed to swish that in your mouth for over 20 minutes. The key word, the key thing is you gotta swish this oil in your mouth for 20 minutes. So that's how it's most effective. If you only keep it in your mouth for 5 minutes, it's not going to be nearly as effective. So a lot of these added benefits that you're talking about is not going to be there. Let me just give you a little background about what oil pulling is supposed to prevent or help with. They're claiming that oil pulling helps with halitosis, which is bad breath, with gum disease, gingivitis, and they're also claiming that it can also prevent or slow down cavities. The way this works is you're supposed to keep and swish a specific amount of oil in your mouth for 20 minutes. What's taking place for our biology nerds who want to know about the technical words is that as you know, the walls of bacteria in your mouth, which are single-cell microorganisms, are made up of lipids, fatty acids, which are attracted to other lipids, like the oils that you're going to be swishing with in your mouth. And so as you're swishing the oil in your mouth and the oil comes into close proximity, as the oil is passing by your teeth, your gums, the bacteria are attracted like a magnet. They're grabbed by the oil and they kind of get mixed into the oil, and when you spit the oil out, all those bacteria are excreted from your mouth. So the most common type of oils used for oil pulling is sesame oils, sunflower oils, and coconut oils. So the coconut oil has the added benefit of having lauric acid in it, which is a known antimicrobial. So not only you're attracting the bacteria to it and you're excreting the bacteria out of your body, but also you're killing off the bacteria with a well-known antimicrobial agent. In my professional opinion, and just to go on record and say that oil pulling is not recommended by ADA to have any added benefits, but there have been some limited research done by some universities that shows there are some added benefits. What I want you to be aware and conscious of, this is not going to replace your routine and daily oral hygiene regimens. It's not going to replace brushing and flossing, but as an added technique to help improve your oral hygiene, I think it definitely has some added benefits and will definitely help you with gum disease, halitosis, and as far as for cavity, there aren't any proven scientific research behind it, but I feel if it helps with the bacteria, it might help with cavities too, but make sure it's only in conjunction with what you already do. Thank you for watching this video. You can also watch some of our other videos. We have a video on apple cider. Please watch that and like us on Facebook. Thank you.